Hi guys, my name is Summer Janae and welcome back to my channel. Today I want to follow up with you regarding the topic that I really got on here to record today. I know I usually make several recordings on the days that I record, but today I wanted to follow up with you and let you guys know that as a part of the series I'm doing on my knee replacement journey, that I completed my joint boot camp, if you will, yesterday. And it was very impactful, very enlightening. The information was, I'm not going to say overwhelming, but I was not expecting to get what I got from that class. And it was absolutely amazing. It helped me to understand that we need to make some adjustments to get ready for the surgery. Like they just brought up some really good tips. And I would say my top five takeaways from the joint camp, if for those who didn't get to attend, or you're getting ready to have surgery and you don't have a joint camp where you live, the top five things that I would share with you that I absolutely think you would need to know if I were you but hadn't attended the camp would be as follows. So, the first thing I thought that was very interesting was that, like, the day of surgery, um, as part of the checklist before you can go home, you have to start physical therapy like as soon as you're coherent enough to come off the medication. That, like, once they realize in this one was mind blowing to me. I'm sorry, but I had to get myself together. Like, I was like, what? What? You mean to tell me the day of surgery we start physical therapy? Yes. So one of the things you have to do in terms of checklists is pick up your two-wheeled walker, um, take it to the hospital with you, because the day that you, like, a couple hours after you're done with surgery, you start physical therapy, and your physical therapy starts with you on the walk, excuse me, on the walker, learning how to use your walker. So that was, I think, one of the most mind blowing things that I heard in the training. Um, Number four, I like the fact that they give you tips in terms of the type of vehicle you should leave the hospital in. Not she said, like, if you have an F-150 and that's all you have, then you have to do it. But understanding that my class was for hip and knee hip or knee replacement patients, so they did not advise you leaving in a really tall, like, pickup truck slash SUV, nor a really small slash low car to the ground, because having to get in and out of your car or is going to be crucial, that you're not making those big moves, leaving the hospital and immediately after. Tip number three that I thought was very helpful, because I was not planning along the lines of what they shared, was you need to take about 2 weeks off from whatever it is you're doing, making sure you keep your routine, coming home from the hospital, like getting up, taking your medication, getting something to eat, doing your exercises, going to physical therapy, making sure that you are consistent with what you're doing and you continue to take your medication, even though you may be feeling better, at least for the first 2 weeks. And then as you are getting past that 2 week mark, then start coming off your medication. And I thought, well, oh, wow, I'm glad she said that, because usually in the past, if I've had a surgical procedure, then I would, once I started feeling better and didn't think I needed the medication, I would just start weaning myself off so that um, there would be like no issues or whatever with, oh, me saying, oh, I gotta have the pain meds when, yeah, I don't need them. But so I'm gonna take their advice to make sure I'm taking it easy for the first 2 weeks before I start to try to return to work or in anything of that nature. So I thought that was very interesting and good information or good advice to have. The second best thing I heard in the class was they were talking about making sure you proof your home before you go in for surgery, i.e., like if there's carpet or a rug or like plugins maybe that are going across your floor, anything that could cause you to trip and fall, you need to make sure those things are out of the way, if you will, and that your walkways are clear. So if the places you would normally walk in your home are you can't get through with a walker before you go to the hospital, then you need to make sure that your paths are clear before you go to the hospital and have the surgery and get your, in my case, your knee replaced. And the number one best tip I thought that they gave us that in my book, I was like, oh, okay, I didn't even think of that. Um, so with our class, they had like different pictures of equipment, medical type equipment that one could either get before the surgery so that it would just be easier for you when you got home. They mentioned getting like a leg. I know I'm saying this wrong, and please forgive me. I'll put the right name on the video once I edit it. But there's like a compression type uh, device, let's say that if you're prone to blood clots or anything of that nature, or if you have a history of blood clots, there's something that you can use on your legs that will compress them so that even when you're not moving, it will help stimulate your legs, especially like when you're sleeping, if you will, so that you have that continuous circulation. We're supposed to be moving like so many times within the hour. We were already given exercises that we need to start right now, that we need to continue after the surgery, that's going to help with building the muscles that are going to be around where the joints will be replaced. And I just was like, wow, I didn't even think about that. We can't wear open toe or closed, wait, we can't wear open toe shoes or like shoes that are like kind of like Crocs or like my UFUs that are open across the back because to help us with making sure we don't trip and fall, our shoes have to be closed toe shoes. And then one lady who's had a couple of, I guess, knee procedure, knee back, whatever procedures, mentioned like there's a little spoon or whatever to help you be able to put your shoes on if you need some assistance putting your shoes on and no one's there to help you. She even mentioned that there's like these socks that are designed to help people who have recently had surgery and they can't necessarily move. Um, but overall, those are the top five things that I can think of that I thought were like very impactful in terms of the information in the joint class. I highly recommend it. And if you don't have a joint class and you want to know more about what they told us, I can do a follow on video. You can just drop your questions, comments, or concerns in the description box. I mean, in the comments section, and I will see if I can find some of the products that they mentioned or things that they were telling us about. Oh, but I have to tell you this one thing, this bonus thing. When I saw it, I was like, oh, she initially started talking about like a portable toilet, I was like, I don't think I want that one. But then when she said that you know you can take the portable toilet part out and just put the top part um, that you would sit on, but not necessarily the part that you would catch that would catch the waste that you're excreting either in a liquid or solid form. But if you take the handles, if you will, um, of the elevated toilet and put the elevated portion over your regular toilet, then you won't have to try to worry about trying to go down so far, if you will, to use the restroom. I thought, now takeaway wise, I thought that was like a really good tip, a pro tip, if you will. They also have like a bar that you can put underneath your mattress that will help you with getting out of the bed. And it was just a class full. There was a wealth of information, and I was like, oh, I was dreading going to the class because it was like an inconvenience. It was only on certain days, and I ended up having to reschedule. And it was just, I was like, I really don't want to go to this class. But after hindsight being 2020, I'm so glad I went to the class, and I would recommend taking someone with you to the class if you have a class in your area, so that they can help capture the information that's coming out of the class. Because to sit there and listen to it as the person who's going to undergo the procedure, it's a lot and you may not capture it all. But I took my daughter with me, and she took some copious notes, and oh my gosh, by the time we came out of there, she's like, oh, we need to come up with another plan. I don't think what we have in place is going to be adequate. We need to account for this. We need to account for this. We need to account for this. So I was grateful to have her there with me to be able to catch things that were outside of the realm of what I was thinking about. Because in my mind, I'm thinking about, okay, I'm getting ready to have this procedure, and this is what we're getting ready to talk about. But they even went over the anesthesia, um, the type of anesthesia we're going to have, the pain medication process and how that's going to work, the recovery process. When I say they walked you from the time you arrive on that day to work, from where you need to start to where you're going to go, what happens next, who can come with you. If you only one person can go to the back with you, if other people come, they would need to go to a particular area. When I say they covered everything, they really thought of everything. And I'm like, just really grateful to have all that information up front. So that's what I wanted to cover with you all. You really need to, if you are getting ready to have a hip or knee surgery or knee replacement surgery, kind of see what resources are available with your the facility that's doing the work for you, or are performing your procedure, so that you are aware of um, what you're getting into pretty much, and what you need to do to prepare for your procedure. That's all I have for you today. I hope I did not overwhelm you, but that's the best version of the 2 hour almost class that I can give you in the amount of time that I've been talking to you today. I pray you have an amazing rest of your day, and go be great.